Good morning, students. Got some issues with Platinum, and the the problem is we got some folks that are not documenting the patients right. So I wanted to go over with you in this video how to do that. It's going to be very quick, but we're going to show you some things. I'm going to actually demonstrate a student that didn't do it right and how you can fix it. So let's see here. Let's pop up our screen here. Now I've already got him. He's logged in. He's actually to his patient screen. And a couple things, again, always check your dates and times, make sure that you clocked in and out correctly. But if we go to his patient, and he did this great job of writing in everything as far as the narrative of the patient, which is fine. You can put that in there. But the thing that we really need, and I wanted to kind of show you why real quick that we need it. If I was to go back right now and look at his report, it would show that he has 0 patients. And this is the reason why. Because the program is counting on the following skill performed. And that's the key thing. So in order to bring up the form to use to document your patient care, you have to add that skill, okay? So when you're under your patient, you're going to go in here, and again, he put in everything that happened with this patient, and that's great, but we're going to go in there and put a skill in there. Now, there's 4 skills in here. There's the clinical skill, patient assessment, emergency room. Now, he was on a transport unit for this particular ride. So for this one, he is going to click patient report. And again, make sure that you always click the successful. We don't want observed. We don't want attempted. We want successful. If it wasn't successful, we don't really want to know about it. So now, if you look down here, it says skills performed. Now, let's say you screwed up and you put the wrong one in there for that particular opportunity. Let's say it was an ER clinical, but you accidentally put in that it was a transport unit. To get rid of it's really simple. You come in here and you hit the X, and it takes it away. So again, we're going to go back in here, and we're going to put the right one in here for him. We're going to click on that, and then your documents. Now, if you wanted to drag, let's say you had some rhythm strips. Remember, we don't put names on there. It's okay to put everything else in there, but anything that's going to identify the patient's a no-no. So let's say if you got the monitor printout, you could actually take a picture of it and drag and drop it to here. Or if you scanned it, you can do that as well. So I'm going to hit save on this. So when I hit save on this one, and now I go to edit the patient, it's going to come in here and it's going to say, hey, you did this. Okay, that's great. That's wonderful. So what we need, by the way, if you did more than one patient, again, then you could do it, but then you're only going to need 1 per patient. So the other thing is now I'm going to hit save, but now when I go to forms, if you look, now there's going to be the form for the patient report. And that's the thing, of course, that you want. And I just want to make sure that this was the, and we did this overview. This was just making sure, this actually was a Timber Ridge freestanding. So what I'm going to do is go back in here into his patient, and I'm going to say, hey, I need to fix that. And I'm going to go in here and say, hey, remember that thing I said it was a transport unit? It wasn't a transport unit. I'm going to go back in here and I'm going to click on emergency room. There is a little bit of difference in the form, just so you guys know. If you have a transport unit one, it actually has what room that the patient was brought to and what their final disposition was. Where in this form it says, hey, what eventually happened to this patient? That's only the big difference in those forms. Okay, I'm going to hit save here. And now, again, I'm not going to do this report for him, but he would also need to do this as well on his patient. And I'm going to let him do it on the second patient. So this is, again, to show you guys, again, you're going to go in. Hey, there's the form. You fill out the form. Again, we like green check marks over here. We don't like this right here. He simply goes down to this form, and then he will click on this, and he will hit fill out form, and then he fills out the form. Okay? When you finish all of that, again, you're going to go down to submit. I've got everything the way I want it to be. I'm going to hit submit my documentation, and I'm move my head over here. Of course, we always like to hit the blue button, okay? But in this case, we're not going to. We're just going to save it the way it is right here and now because he has to go back in and fix this. So, again, I just wanted to kind of show you guys how to do that. Make sure that you do that on every patient, especially in EMT. This is how you get counted. And I'm just going to go back and show you guys what I'm talking about here. So when I go to pull my report, and I go to report on Ben, because Ben hasn't done all this stuff, I'm going to hit, let's see here, student progress report, and I'm going to select, because he's in Miss Fairchild's, and the student was Mr. Ben Williams. If I can find him here, there he is. All right, and then if I go in here and I say run the report, and then there we go. But see, if you notice, when we go down here to the bottom, when it says how many of the now he actually has multiple patients in there right now, but because he didn't put in those reports the way that they were supposed to, it's showing that he didn't see any patients. Okay, and that's very important, because that's what we're actually counting right there. Okay, so again, make sure that that's put in, because if not, it's going to say 0. And remember that all of this has to be at 100%. All of this has to be at 100% before we allow you guys to take the final test. Okay, so that's the quick overview. I hope this helps, and I will see you guys on the next video.